My patient Sarah noticed persistent night sweats that soaked her bedding for months, dismissing them as normal aging. By the time she sought medical attention, her cancer had already progressed to stage 3. Her first question was heartbreaking. If I had known earlier, could I have been saved? The answer is yes. These 8 early cancer warning signs are easily overlooked. Appearing as subtle, everyday symptoms people typically explain away. Recognizing even one could mean the difference between early treatment and a terminal diagnosis. Sarah's story is just one example of how these warning signs can go unnoticed until it's too late. Most of us reach for antacids when heartburn strikes, after enjoying a spicy meal or drinking too much coffee. But what if that burning sensation in your chest isn't just an inconvenience? What if it's trying to tell you something far more serious? Persistent heartburn affects approximately 60 million Americans, yet few recognize when this common condition becomes a potential warning sign. Think of heartburn like a fire alarm in your body. Occasional alarms might just mean burnt toast, but persistent alarms signal something requiring immediate attention. The key difference lies in the pattern. While occasional heartburn comes and goes, cancer-related heartburn persists for weeks or months and often doesn't respond to normal medications. When stomach acid repeatedly backs up into your esophagus, it damages the delicate lining over time. This chronic irritation can lead to Barrett's esophagus, where cells actually change their structure. About 10–15% of people with chronic acid reflux develop this condition, significantly increasing esophageal cancer risk. Watch for additional warning signs suggesting your heartburn requires medical attention. Difficulty swallowing or food getting stuck in your throat indicates potential esophageal damage. These symptoms, alongside unexplained weight loss, suggest your body is struggling with a serious underlying issue. What makes this especially important is that esophageal cancer is often diagnosed at advanced stages. When persistent symptoms are investigated promptly, the 5-year survival rate jumps dramatically from 20% to over 80%. This stark difference underscores why paying attention to that persistent burning sensation in your chest could literally save your life. Early detection dramatically improves survival rates for all cancers. But first, we need to recognize the warning signs our bodies send us. One of the most overlooked signals occurs while most people are asleep. Have you ever woken up completely drenched in sweat? Your pajamas pancaked against your skin and sheets soaked through as if raindrops were falling indoors? This isn't just an uncomfortable night's sleep. It's potentially your body's midnight alarm system trying to alert you to something serious happening beneath the surface. Let me explain why this matters. While occasional night sweats happen to everyone, there's a significant difference between normal perspiration and what medical professionals classify as a warning sign. The key distinction lies in both severity and pattern. Cancer-related night sweats are notably severe, requiring you to change your clothes and bedding. They also follow a consistent pattern, occurring night after night, regardless of your bedroom temperature or evening meals. These drenching episodes are what doctors categorize as B symptoms, often signaling the presence of lymphoma when accompanied by unexplained weight loss and overwhelming fatigue. Your body's internal thermostat essentially goes haywire. Cancer cells, especially in lymphoma, directly disrupt your temperature regulation system as your immune system responds to their presence. Unlike normal sweating, related to hormonal changes or external conditions, cancer-related night sweats occur regardless of these factors. Your body is literally sounding an alarm that something isn't right. If you experience drenching night sweats more than 3 times a week, particularly with unexplained weight loss or persistent fatigue, consult your doctor immediately. Don't dismiss these episodes as just poor sleep conditions or hormonal changes. Your body communicates danger in various ways, and sometimes the warnings are hiding in plain sight. Did you know that a simple change in skin color could be the difference between a 3% or 40% survival rate for certain cancers? That yellowish tint many people attribute to tiredness or aging could actually be jaundice, a critical signal that requires immediate medical attention. During a holiday gathering, Sarah's family noticed the whites of her eyes turning yellow. She dismissed it as fatigue from stress and lack of sleep. 3 weeks later, she received a devastating pancreatic cancer diagnosis. This yellowish discoloration serves as a window into your internal health. Jaundice appears when bilirubin, a substance from the breakdown of red blood cells, accumulates in your bloodstream instead of being properly eliminated. Your liver normally processes this waste product efficiently, but cancer can block the bile ducts, causing this system to fail. Jaundice typically appears with companion symptoms that should trigger immediate concern. Look specifically for dark urine resembling cola, light-colored or clay-colored stools, and pain in your upper abdomen. Together, these signs indicate your body's waste removal system is struggling. For pancreatic or liver cancer patients, jaundice often signals the disease has already progressed significantly. This makes quick action essential. If you notice unexplained yellowing of your skin or eye whites, don't attribute it to poor lighting or wait to see if it resolves on its own. Schedule a medical appointment within days, not weeks. While jaundice can stem from less serious conditions like gallstones or hepatitis, quickly ruling out cancer should be your priority. The reality remains that early detection of pancreatic cancer can dramatically shift survival odds, potentially increasing 5-year survival rates from just 3% to nearly 40%. While visible symptoms like jaundice alert us to internal problems, some cancer warnings manifest as pain that's easily dismissed. That persistent ache you've been attributing to age or overexertion might actually be your bones sending a critical message that most people miss until it's too late. Robert's experience highlights this danger. After enduring weeks of deep, nagging hip pain that intensified at night and resisted over-the-counter medications, he sought medical help. What he believed was just an old sports injury flaring up revealed itself as something far more serious. Cancer-induced bone pain has distinctive characteristics that set it apart from ordinary discomfort. Patients describe it as a deep, penetrating ache originating from within the bone itself rather than surrounding muscles or joints. This quality helps doctors identify potential issues during evaluation. Unlike normal muscle or joint discomfort, where changing positions provides relief, cancer-related bone pain hangs in the air like an inescapable presence. The pain persists regardless of how you move, and standard painkillers typically offer minimal benefit. If your persistent ache doesn't improve with rest or repositioning, consider this a warning sign warranting medical attention. Medical imaging reveals the underlying cause. Sometimes cancer originates within the bone itself, primary bone cancer. Alternatively, cancer cells may travel from elsewhere to settle in bone tissue, creating metastatic cancer. Both scenarios cause structural damage as cancer cells create pressure and compromise bone integrity. Be particularly vigilant if bone pain appears alongside unexplained swelling or if you experience fractures from minimal trauma, like breaking a bone from a minor bump or fall. These additional symptoms suggest the bone structure has already been significantly weakened. Not all cancer signs require advanced imaging to detect. Sometimes the warnings appear right on our skin, visible to the naked eye if we know what to look for. Those small, seemingly innocent purple spots that appeared on Lisa's legs that weekend weren't just a minor rash. They were potentially life-saving messengers her daughter fortunately noticed during a family visit, likely saving her mother's life through this simple observation. While most skin discolorations come from harmless sources, certain distinctive patterns deserve immediate attention. Petechiae, those tiny red or purple spots, have a critical identifying feature: their behavior under pressure. When you press on most rashes, they temporarily lighten before returning to their original color. These blood-related spots, however, remain unchanged when pressed. A simple distinction that can signal something far more serious than an ordinary rash. These purple skin markers become particularly concerning when they appear alongside other subtle signs like unusual bruising from minor bumps, bleeding gums during normal brushing, or persistent fatigue that sleep doesn't seem to improve. Together, these visible symptoms create a pattern that demands professional attention. You can check suspicious spots at home with a simple blanch test. Press a clear glass against the skin. If the spots remain visible through the glass, rather than temporarily disappearing, contact your doctor without delay. The emotional relief of catching potential blood disorders early makes this simple test worthwhile. Skin manifestations like these frequently serve as the first noticeable sign of certain blood cancers appearing before other symptoms develop. Their pattern can help specialists narrow down potential causes, making them valuable diagnostic clues that shouldn't be ignored. While visible signs may appear on your skin, internal signals like fever can be equally powerful messengers of blood cancer. Mark's story illustrates how crucial this warning sign can be. His persistent low-grade fever continued for 3 weeks, despite antibiotics. When his doctor ordered additional testing rather than prescribing another round of antibiotics, it revealed lymphoma at an early treatable stage. Fevers associated with cancer demonstrate distinctive patterns that separate them from ordinary infections. They follow a stubborn, cyclical rhythm, appearing for several days, vanishing briefly, then returning without explanation. Like a faulty thermostat that can't maintain proper temperature, your body fluctuates between hot and normal. This temperature roller coaster becomes especially suspicious when antibiotics and antivirals fail to resolve it, signaling something more complex than a typical infection within your body. Medical research explains why these persistent temperature elevations happen. Blood cancer cells interfere with your immune system and release substances that directly impact your body's temperature regulation. When your temperature repeatedly spikes and falls without responding to standard treatments, your body is desperately alerting you to the battle happening in your bloodstream. These fever patterns become particularly significant when associated with other subtle changes. Combined with unexplained weight loss and those drenching overnight sweats we discussed earlier, physicians recognize this constellation as B symptoms, a medical term that immediately raises concern for lymphoma. Approximately 20–30% of lymphoma patients first notice something's wrong because of these persistent temperature fluctuations, making fever an essential early detection tool. The presence of these B symptoms meaningfully impacts both prognosis and treatment approaches, often indicating a more aggressive disease requiring prompt intervention. Any fever lasting longer than 2 weeks, especially one following a cyclical pattern, warrants medical investigation rather than continued self-treatment. Beyond internal symptoms like fever, cancer sometimes announces itself in plain sight, yet in unexpected places. While most of us diligently check suspicious moles or skin growths, we rarely consider our fingernails as potential warning sites for cancer. That dark streak running vertically down your nail that hasn't grown out with the nail itself could be subungual melanoma, a rare but dangerous form of skin cancer developing beneath the nail. When Maria's manicurist spotted a dark streak on her thumbnail, this warning sign almost went unnoticed. This mark had distinct characteristics, separating it from common nail issues. Here's what makes such streaks concerning. Unlike bruises, which gradually grow out with the nail. Unlike fungal infections, which cause general discoloration, the melanoma streak remains fixed in position. It typically widens and darkens over months. Dermatologists pay special attention to Hutchinson's sign, when the dark pigmentation extends beyond the nail onto surrounding skin of the cuticle or nail fold. Picture it as a shadow escaping the confines of the nail's natural borders. This migration beyond boundaries signals potentially cancerous cells spreading outward from the nail matrix where the nail forms. The real danger lies in how easily these warning signs are dismissed. Most people attribute such marks to minor injuries they don't remember or ignore them until pain develops, which unfortunately occurs only in advanced stages. Initial misdiagnosis rates remain high, with patients often receiving treatments for fungal infections or being told to simply watch it for months before correct diagnosis occurs. Though rare, subungual melanoma warrants attention precisely because it hides in plain sight where we least expect cancer to appear. The misdiagnosis pattern doesn't just apply to nail abnormalities. Our eyes can also harbor subtle warning signs of cancer that are frequently overlooked. That persistent discomfort you've been attributing to screen fatigue might warrant closer attention, especially when conventional remedies prove ineffective. David's experience highlights the critical difference between common eye strain and something more serious. He attributed recurring eye pain and flashes of light to computer work for months. During a routine eye exam, his ophthalmologist identified an ocular melanoma, a condition so rare the specialist had seen it only twice in 20 years of practice. Ocular melanoma symptoms persist like a shadow lurking behind everyday eye strain. While standard fatigue improves with rest, cancer-related symptoms remain despite lifestyle changes. Watch for persistent pain, blurred vision unimproved by new prescriptions, and particularly a dark spot on the iris that changes appearance over time. These warning signs emerge because ocular melanoma develops in the eye's pigment-producing cells, creating internal pressure and disrupting normal vision. Certain individuals face elevated risk. Those with fair skin, light-colored eyes, or extensive unprotected sun exposure should be especially vigilant. Though rare, this condition demands our attention because early detection significantly improves outcomes. What makes this cancer particularly dangerous is its hidden development. The tumor often grows internally without external signs visible during casual observation. This concealed progression underscores why comprehensive professional eye examinations are essential. Specialized imaging can detect these growths before they cause permanent damage. Regular screenings represent your best defense against this silent threat to vision and life. We've covered 8 critical early warning signs that could potentially save your life. But what's most important is understanding their significance in the broader picture of cancer detection. 1 in 3 people will develop cancer at some point in their lives, highlighting why vigilance matters. Your body communicates problems through whispers long before it starts shouting. Those persistent symptoms that seem minor, the unusual fatigue, that odd mark on your skin, deserve attention. Trust your instincts when something feels wrong, even if it seems insignificant. Remember, early detection makes the difference between life and death. As we've seen throughout these warning signs, acting promptly improves outcomes dramatically. You know your body best, and acting on that knowledge could be the most important decision you ever make.